Hookah use has been significantly increasing among younger age students, mainly in high schools and universities in the United States. Partly because there's a lot of myths associated with hookah. It's thought to be very harmless. Generally people think it's much better than cigarette because the hookah smoke, goes through the water or whatever liquid solution they use, in the water pipe, and it's thought to filter out all the impurities and nicotine, and generally students think that there's not a major problem with using hookah, and nothing can be farther from the truth. Hookah smoke has the same and much more ingredients than cigarette smoke, and it is probably 100 times equivalent to a single cigarette. It would be a single hookah session because it lasts very longer. The hookah session lasts 45 minutes to an hour, and they smoke in groups. There's a lot of secondhand smoke, and usually the volume of smoke inhaled is probably 100 times the cigarette. Even though they smoke on weekends, it may be equivalent to smoking several packs at the same time. Unfortunately, the practicing physicians are not much aware of this. Their probably general perception is, yes, it is out there. It may be as bad as cigarette, it's maybe a little bit better, and it's not a big deal. It's more common in Middle Eastern population. And nothing can be farther from the truth. And we physicians are also not aware of the fact that there's a significant percentage of college students use hookah. There's a new study which came out in the University of Florida, which was published this year. Very surprising. They looked at nearly 700 students, and they looked and see how many people smoked cigarettes and how many people smoked hookah. And the hookah ever use, meaning they ever tried hookah, was much higher than ever tried cigarettes. This is the first time in a large cohort, even though it's only a small university cohort, that they have shown that the use of hookah is more than the use of cigarettes, this is very concerning. I think there are several things we need to be. First, the myths of the hookah needs to be much more dispelled among the younger population. The physicians have to learn more about this. Physicians need to ask the patients, even the older patients, about hookah use, simply because they may go back and check with their kids to see whether they're smoking hookah or not. It's very rare you're going to find an 18 or 20-year-old come regularly to the clinic for any reason. But a 50-year-old parent, 60-year-old parent, you ask them, and they're going to ask you why you are asking this, and they're going to go back and check with their students, and that's very important. And we need more research among the effects of hookah among lung disease and cardiovascular disease. There's also a lax regulation among hookah. In some places it falls under the Tobacco Act and Clean Smoking Air Act. In other places there are a lot of exemptions. This is not considered as tobacco in some places, and we need to get a better regulatory mechanism so that this can be implemented better. The main concern is people start with hookah and then they go back to cigarettes. We have made impressive strides in the last 40-50 years by reducing smoking in this country. The concern is that students use hookah in their universities, and they get out in their real life, they're going to go back to cigarettes because it is as addictive, if not more, than cigarettes.